highlight to think about is our work overseas in East Africa, for example. We have studies in very high density human populations, so urban slums near Nairobi in Kenya and in wide open pastoralist communities in northern Tanzania, looking at questions of what are the risk factors for carriage of antibiotic resistance. And one of the take-home messages from that work is it's not just antibiotic use. That's kind of the ultimate factor in what selects for resistant strains. But the other big question is, how do they get around? And that's what we call a proximate factor. What risk factors are there that these people are exposed to based on their cultural practices, their behaviors, and their situations and their ecology that promotes that spread of the resistant strains? And in Maasai households, we actually find that the practices of how they handle milk are very important. So milk is a very important product at the household level for Maasai pastoralists. They have a lot of cattle. But oftentimes that milk, even when it's boiled, is quickly recontaminated with resistant bacteria, and then they are then consuming those resistant bacteria. When you go into a place like Kibera, which is a high-density population, high-density slum attached to Nairobi, there you have sanitation conditions which are extremely unfavorable for health, extremely favorable for transmission of bacteria. Add to that frequent use of antibiotics, and you have the perfect combination of selection from the use of the drug, contamination with resistant bacteria and pathogens which cause disease and have more selection, drive or demand for the antibiotic use. So we get into these cycles that are really driven ultimately by the fact that sanitation is such a challenge in these communities. So we're looking at those factors and how we can start mitigation practices and test those ideas to try and reduce the burden of disease and carriage of resistant bacteria.